ADHD. Over 5 million kids in the United States have it. But there's a lot of controversy over how to treat ADHD. Medication is the default solution, but is there a better way? We're about to find out. I'm Mike Tucker, and we're here to help you create your best life possible.
This is Lifestyle Magazine with your hosts, Dr. Charmaine Long, OBDK, Lionel LaMountain, and Mike and Gail Tucker.
Dr. David Velkoff is the medical director and co-founder of the Drake Institute of Behavioral Medicine, which became a world-renowned ADHD and autism treatment center. He will tell us about ways of treating ADHD without using medication. Welcome, Dr. Velkoff.
Welcome.
It's a pleasure to be here with both of you. Thank you.
I am so glad you're here, because I have to confess, the only thing I know about ADHD is my friends bragging that they had it. And they'd say stuff like, squirrel, and I always took it to be, it's just their excuse that I was boring them or something. They no longer were paying attention to me. So please tell us what ADHD is and what it isn't.
It's a neurodevelopmental disorder. It's due to dysregulation in certain areas of the brain. It causes symptoms of inattention, distractibility. It's very hard for the child to stay focused unless it's something very interesting to them. If it's a video game, Legos, TV, they're fine. They could play it for hours. But on non-preferred tasks, if the frontal part of the brain is not what we call activated, it's really hard to sustain concentration. So they get very bored easily. So inattention is a symptom, is the most common symptom. Half of kids with ADHD also can be fidgety, hyperactive, difficulty sitting still, and they can have difficulty with impulsive behavior.
So this dysregulation, it's a cognitive issue in the mind, in the brain?
It's a neurophysiologic problem where certain what's called networks in the brain are not working effectively. They're not working efficiently. They may be underactivated or they could be overactivated where they're dysregulated. So whatever function they're involved with is going to be compromised. If it's, for example, you'll see areas in the frontal part of the brain that are not working efficiently, kids with attentional problems. With autism, you can see areas in the right posterior part of the brain that aren't working efficiently, dealing with picking up on nonverbal social cues. If there's an auditory processing problem, you can see the left temporal area of the brain is not working normally. So if you correlate the patient's symptoms to the brain mapping, then you really know if the symptoms are neurologically linked as opposed to maybe they just need some parenting courses.
You mentioned something, brain mapping. What
Yes.
exactly is that?
It's a special type. It's a special type of EEG where the recordings are digitalized. It's then processed through an FDA-approved database of normal brain functioning. So let's say we have an 8-year-old child who his parents have to micromanage him or her through homework, or the teacher says, your child's disrupting my class. You do a brain mapping. You compare the child's brain mapping to the normal for their age to see if all the different areas of the brain are working normally. Particularly in the last 5 years in neurosciences, the technology has so exploded that we have technology today we didn't even have 6 months ago in doing analysis and then remediation.
So are we finding more children being diagnosed with this new technology within the last 6 months?
No, we're diagnosing them more accurately and more thoroughly, and we have more data to work out a better treatment to help them through what's called neurofeedback or biofeedback.
Do you think that ADHD is overdiagnosed now? It seems like it's become such a common thing.
I think that sometimes it's overdiagnosed and there's no careful evaluation of the patient. Parent fills out a checklist, doctor interviews the patient for 15 minutes and puts the child on a drug. So I think sometimes it's overdiagnosed because of superficial evaluations. But also, just because a child has trouble focusing, and let's say it is due to ADHD, they could also have a secondary learning disorder or a secondary auditory processing disorder that's also affecting their ability to focus that's not due to ADHD.
And kids can have difficulty focusing because of psychosocial problems as well.
Absolutely. And then having ADHD is going to produce psychosocial problems because you're getting criticized all the time. Your parents are having to micromanage you through homework. You're blurting out, interrupting in class. You're getting negative feedback from the teacher. And this innocent child is getting all this negative feedback from the outside world, and they're just being themselves.
You see, and that's the thing. I'm scared of it being overdiagnosed just because there might be professionals who want to have an easier child to manage. I don't know if that's true or not.
Do you mean like teacher professionals?
Okay, like teacher professionals. I'm glad my teachers didn't have access to that when I was a kid growing up. But is it when they want to manage a student more effectively, do you think there's a tendency to
Sometimes
overdiagnose?
people want a quick fix.
A quick fix.
And my experience in medicine is quick fixes are superficial and they don't work.
Yeah.
You know, as we were having our discussion earlier before the program, if a physician, an endocrinologist, thinks that someone has symptoms of thyroid disease, you don't just put patients on medication. You want to do thyroid blood tests and see how their thyroid is working. So if someone is having symptoms coming from the brain, it's kind of common sense. You want to look at analyze brain functioning first, and let's see what's really going on.
How often is that actually done?
Too few, not often enough, but it's becoming more and more prevalent because there's more and more research and evidence linking findings on brain mapping to ADHD. The evidence today is overwhelming, but sometimes doctors are not always open to new information.
Do you think the average pediatrician is equipped to accurately diagnose ADHD?
A lot of them are not really trained thoroughly in neurodevelopmental disorders. They could be wonderful pediatricians, but neurodevelopmental disorders is not really their specialty.
So what is it not? For someone who might think they're seeing ADHD, what is it not?
Every child is going to have moments of being hyperactive, sometimes fidgety, bored, difficulty focusing, or sometimes impulsive behavior. That doesn't mean it's ADHD.
Amen.
It's only ADHD when these symptoms are beyond the norm for their age, where it's disrupting their life. It's affecting their ability to achieve their full ability in school. It's causing parent disruption, family problems. It has nothing to do with parenting. So, and then if you do a brain mapping, you can see if it's neurologically based. The worst news I can ever give a parent is a parent comes in, they're sure their child has ADHD. It's all ADHD.
Yes.
Do a brain mapping, it's normal.
And you said you used a very important word. You said disruption. And that's what you're looking for. We have a lot more to discuss. When we return, Dr. Velkoff will tell us about specific treatments that work with this ADHD symptom so many people have.
Stay with us. There's more Lifestyle Magazine coming up.
Dr. Velkoff, how is this disorder normally treated?
With drugs.
Okay.
Stimulant drugs, usually amphetamines or amphetamine class drugs, is the widespread conventional treatment.
That sounds counterintuitive, doesn't it? A stimulant drug for someone who is hyperactive.
It's counterintuitive. However, if you do a brain mapping, you'll see that if a child's hyperactive, most frequently the frontal part of the brain is underactivated. So if it's underactivated, it's like not having brakes on a car, so it's not inhibiting their impulses, their excessive motor activity.
All right.
So if you put them on speed, really the drugs they use are speed, it's going to speed up the frontal part of the brain. It will then start kicking in to inhibit their hyperactivity, but it's just it's a drug effect. It's not real in terms of the brain getting better. It's it's like taking aspirin for a fever when you're coming from a bacteria infection, but you don't treat the underlying infection.
Right.
All you're doing is suppressing your temperature, but you're not getting at the cause of why you have a fever.
And you're giving a child a drug.
These are not benign drugs. Most of the drugs used are amphetamine class drugs.
Same
and
drugs.
it's common sense that why would you want to have anybody on an amphetamine drug chronically, much less a child whose heart and brain are still developing. Now, I will say this. There are patients sometimes that may need to be medicated as a very last option when nothing else has helped and their self-esteem is in the gutter. You may have to consider that, but it should be way far down the road in choices. Unfortunately, it's usually the first choice.
Same for both children and adults? Same medicines, drug treatment?
Yes.
Okay.
Yes.
Dr. Velkoff, how often are there misdiagnosed cases? Just because how can you differentiate between a kid that's just generally hyperactive because they're just young and like to get in a little trouble, or a kid that really has ADHD?
That's a great question. I would wait till they're 4.5 to 5 years old. Most 3-year-old children look like they have ADHD.
That's our granddaughter.
Yeah. And that's normal when you're 3.5, but it's not normal when you're 5.5.
Yeah. Right.
And you could look for if a child's born premature or there are complications during labor and delivery, fetal distress, umbilical cord around the baby's neck. Those are, or the mother had gestational diabetes, those are predisposing factors for ADHD.
Low birth weight, is that also?
Low birth weight, absolutely. Frequent recurrent ear infections at early ages also increases the likelihood.
What about a head injury?
That was what I was going to say next.
Oh, okay.
Well done.
Absolutely.
Head of the game.
Every child usually is going to fall and hit their head. Has to be a significant head injury.
Yeah.
And kids playing soccer today using their head, not a real good idea, because
headers.
No headers, huh?
No, you could have multiple head injuries and not one of them is strong enough to cause a concussion, but cumulative is worse.
Wow.
Is worse than a concussion. We had last year we were part of a study. Representatives from the National Football League asked us to help, and we did brain mappings of 5 former NFL players who were developing some symptoms of pretty severe progressive brain damage, brain injury. And we had one patient, he was the most severe brain map of all. He never even had a concussion, just a lot of head injuries, but not one was severe enough to a concussion. His brain was in total chaos with how the different areas are communicating.
Well,
so,
back to your treatment of children with this disorder. How do you do it differently?
we do what's called quantitative EEG brain mapping. It shows the electrical activity of the brain. Is every area of the brain working normally? And also, very importantly, are the different areas of the brain working together? Are they communicating? Mm-hmm. You can have the areas fully activated, but the connectivity is abnormal. The link from one part of the brain to the other is not sending information efficiently from one area to the other. Okay. So it's like the left hand and right hand are not talking to each other. Okay. Mm-hmm. And we see that. So depending on what we see on the brain mapping, we then know what type of neurofeedback, its form of biofeedback, will help that child's particular symptoms. I can have 10 kids that are hyperactive, impulsive, and their parents have to micromanage them with homework every night. Every child's brain map is different.
Can you explain the biofeedback a little bit?
Yes. You have a sensor hooked up to your head. It's recording your brain waves. And you see your brain waves on a computer screen in front of you, but your brain waves are converted into a video game. So let's say that you're not producing enough fast brain waves in the frontal part of the brain that enable you to focus and concentrate. But even if you have ADHD, your brain is going to produce a fast brain wave sometimes, but not enough to make a difference. Let's say 1 out of 10 seconds. So the child sees that 1 out of 10 seconds. What happens on the computer screen? A fish jumps in the river. So they want to make that fish jump more frequently into the river. And every time the fish jumps in the river, they get a point on the screen. So we teach them how to relax and focus, and their brain starts tracking what's changing on the screen. So the brain, it's called operant conditioning in psychology learning theory. So suddenly the fish start jumping in the river 3 out of 10 seconds, 4 out of 10 seconds, 5 out of 10 seconds. Suddenly the child notices they're feeling a little bit different. Let me see if I can keep that feeling going.
It's like increasing that pathway.
You're developing a new neural pathway. If you do it over and over and over, eventually you don't need feedback. It becomes, it's there long term. Kind of like learning how to ride balance on a bicycle. Once you learn that feeling and you stabilize that feeling, it's internalized in you for the rest of your life.
So you're retraining the neural pathways.
You're creating new neural pathways that weren't there, or retraining neural pathways that were misfiring.
That's amazing.
It's the ultimate in terms of retraining the brain.
And so we're not using a drug. We're
using the brain's own ability to heal itself. Your brain is the best pharmacy anyway.
Yeah.
Interesting.
Well, that's amazing.
It must just bring tremendous hope to parents' hearts when they hear that. There's something I can do for my child that's not giving them a drug.
We had a child come here this spring. The father, they live on the East Coast. The dad was out here on business and heard about our institute, came over and looked at a video film we show, and a week later his daughter was here.
Yeah.
And she was on, I won't say which one, but she was on one of the amphetamine class drugs for ADHD and still not doing real well. And she came out here for 2.5 months. We treated her 5-6 days a week. She's off medication completely now, and she's doing very well in 3rd grade. So that's very gratifying.
My producer and director are ADHD, and they're telling me it's now time to change things. So we're going to take a break, and we'll be right back after this.
Lifestyle Magazine will be right back.
Dr. Velkoff, your description of your treatment is fascinating to me. Could you expand upon that for us?
Sure. We do a clinical evaluation first to look at the whole clinical history of the patient. What are their symptoms? How long have these symptoms been going on? how is it disrupting their life, how is it disrupting the parents' lives. Then we do a brain mapping to see what is the linkage between the symptoms and the brain mapping. The worst news I could tell a mother is, I'm sorry, your child's brain mapping is normal. It's not neurologically based.
You got to figure out something else.
It's okay.
You need some family therapy. But usually it's neurologically based. Parents know that, and most of our parents are phenomenal parents. They've tried every technique in the world to help their child, and it doesn't work, because if the brain is dysregulated, it's not going to be receptive to the best parenting. So when you can identify what networks in the brain are not functioning optimally, causing the symptoms, we treat one area of the brain at a time with neurofeedback, where the child can help develop that area of the brain to working more normally. Then we work with parents, our therapists work with parents to help parents learn how to motivate the child, how to reward the child when they're doing better. You want to, that child, we have kids coming to us, they're burned out on themselves. They've been criticized so many times. The teacher has them labeled as a problem child, or the parents are blamed that you don't know how to parent your child. And
they've done studies of parents with even non-ADD children, and they find that the ratio of negative to positive is more like 3 to 1. 3 negatives for every positive. I have a feeling it's off the scale for kids with ADD.
You're very astute. That's exactly right, because the child is doing things every day or not doing things that they should be doing. So they're very vulnerable being criticized, and to the parents it looks like my child's lazy, unmotivated, or what's wrong with me as a parent. Parents unfairly blame themselves. So in the course of the treatment, our therapists meet with parents periodically to help them identify and review improvement. Let's say that after about 3 weeks of treatment, it takes 32 treatments, at least 32, unless they're on a lot of medication. It could take more, but usually it's 32, a minimum. Let's say after 10 treatments, the child now is starting their homework on their own. Now, they're not finishing it on their own, but at least they're getting half of it done on their own. Never happened before. You want to let your child know, you see, look how you're improving, look how your brain's getting stronger, so the child starts to believe in themselves so they never believed in themselves before.
Awesome.
So there are many, or let's say you ask your child to go do 3 things in a row. You know they're not going to do it. And they did it.
Yeah.
Well, that needs to be recognized and praised. You want to make a big deal out of it. You know, a number of years ago, we had a child come to us that was born with severe congenital heart disease, had 2 open heart surgeries before he's a year old. All of that anesthesia severely injured his developing neural pathways. Comes to us, he's 10, parents are burned out, he's got an attention span of about 5 seconds, and his mother had to micromanage him literally 24/7. After a month and a half of treatment, he's doing his homework on his own.
Wow.
After 3 months, he's given Student of the Month award.
Oh,
So
my goodness.
we made it a big
Yay.
we made it a big deal. We have a conference in our clinic with all of our staff, his parents, and told him how proud we was of him. And we teach kids how to practice in school what they're learning in the actual treatment sessions. We call it the focusing response. So when you're focusing on that computer screen, hitting the right brainwave patterns, you want to think about that when you're in class. So I said to him, I said, you must be using your focusing response all the time now. He says, nope. He says, I don't need it. He says, my brain works that way automatically now.
Isn't that wonderful?
Well, it took, but
so
his
good.
parents were wonderful. And in those 3 months, every time they saw him do something better, they reinforced it and praised him. So the parents are very important part of the healing process.
Are there dietary factors that can worsen ADHD?
Yes. Stay off of sugar, red dye. A small percent of kids, a very small percent, could be gluten sensitive, but if it's your kid, it's going to have an impact. Definitely stay off of sugar as much as you can expect a child to stay off of sugar. But when we have parents come to us and the child has an impeccable diet, impeccable nutrition, great parents, and the child can't do his homework on his own, or the teacher is complaining, I can't teach my class because of your kid. You know that there's something else going on, and that's when you have a high suspicion this is neurologically based.
What's the success rate with the non-drug related approach in terms of curing ADHD?
I could tell you, in our particular clinical experience, it's 80% plus. We'll get significant improvement.
That's really good numbers.
Fantastic.
Not everybody gets off medication, but most kids get medication reduced, if not
Do
eliminated.
you treat adults as well? And if you do,
Yes.
is it different than how you treat children?
Yes. Adults also typically will have stress or anxiety superimposed on top of the ADD because it's been going on for so long. They've just had a harder road for so many more years. And by the time they're adults, whatever compensatory strategies they develop to try to get to adult life, having ADD, they don't work anymore when you're an adult because you're under so many more demands.
Is it harder to develop the neural pathways in adults than it is in children?
Yes and no. Yes, but not if they're motivated.
Okay.
If they're desperate and their back's against the wall and they have to change, they could do as well as children, but they have to be really motivated.
All right.
And not self-medicating.
Mike, you got a question?
I need to stop us. That's what I thought. You're right. You're very perceptive. We'll take a break and we'll be back right after this. Wait a
Lifestyle Magazine. We'll be right back.
Doctor, there are parents watching today who are in need of some hope. What can you say to them?
I have been involved in helping thousands of children who were diagnosed with ADHD who were able to completely heal their life.
Wow.
And develop very, very successful lives. So if it's diagnosed properly and helped properly, it can be helped without drugs successfully. I've seen that firsthand for many, many years. It doesn't have to be permanent. And also, you need to realize your child is not willfully being this way, and it probably has nothing to do with your parenting. It's just the way the brain is wired. I had a mother call me recently. She says, Dr. Velkoff, you're not going to remember me. You treated my son 21 years ago. And I said, you know, I don't remember a lot of our patients. I've helped thousands, but I really do remember your name. And she says, well, Josh, you treated him when he was 7 years old. It changed his life. He's 28 today, and he graduated college with highest honors, and now he's studying to be a priest. But she says, I'm calling you not because of him. I'm calling you for me. She says, now it's my turn to be
My
treated.
turn. Thank you, Doctor. Thank you so much. There is hope, and thank you for bringing that to us.
Thank
and
you.
thank you for being a part of this one today as well. We look forward to seeing you again next time. But until then, you take care of yourself. Bye-bye.
Thanks for watching Lifestyle Magazine. We look forward to being with you again next week. To get a copy of today's offer, call 888-940-0062 or go to lifestyle.org. That's lifestyle.org.